Welcome to the Omaha Magazine podcast. It's about all of us, where we highlight Omaha business and community leaders, arts and culture, and where to dine and play. I'm Gil Cohen, Executive Vice President of Sales and Marketing at Omaha Magazine. Is our healthcare system broken? On this episode, we're joined by CHI Health Immanuel Hospital President and CEO, Anthony Ashby. Anthony will share with us how they've continued to provide care for our community members amidst floods, storms, and the global pandemic. All right, welcome back to the Omaha Magazine podcast. It's about all of us. We have a great guest this afternoon or morning or evening, whenever you're going to watch this episode. Yeah. Anthony Ashby, who is the CEO and President of CHI Health Immanuel Hospital.
Correct. Yep.
And so welcome to the podcast. Great to have you on.
Thank you. It's a pleasure. Thanks for the invite.
Yeah, no, appreciate it. So both of us are from the East Coast.
Yep.
You're a Baltimore guy. I'm a New Jersey guy.
Yeah, rivalries.
Well, I guess the Eagles and the who's the Baltimore team?
The Ravens.
Ravens. Yeah.
Oh, come on, don't do
I keep thinking of the Colts. That's why.
Are you a New York fan then?
No, Eagles fan.
Oh, okay. There you go. Well, yeah, that's depending on the part of Jersey.
Yeah. South Jersey, Philadelphia area.
It's funny not being from here. I never would have thought there was more similarities between East Coast cities that are so far apart compared to Nebraska. So we're in Nebraska. If I meet somebody from Massachusetts, there's more of a connection between like Massachusetts and Maryland compared to Nebraska than I would have ever thought. You know, being on the East Coast, it seems worlds apart, but when you move over to Nebraska, there's a lot of differences. Yeah,
and they're short drives too.
Yeah,
you can go from South
to get
Jersey
out of Nebraska west. I mean, I could be in Maine from Baltimore. So it's a little different.
Exactly,
I like road trips though. So
very cool. And so you've been in Nebraska since 2019, roughly.
Yep,
is that right?
Yep, 2019. Yeah.
Okay. What got you interested in coming out here from? Why did you give up the East Coast? I can tell you where I did, but
yeah. So
I was told to move here.
Volunteer. That seems to be a lot of the story. I was actually working at Johns Hopkins for a bit, which is kind of a dream, being in healthcare, working at Johns Hopkins, being from Baltimore. It was very cool. There was a reorg and I ended up getting laid off. Okay. And I found a job in Dallas, actually at a health system. I'd done consulting previously, so moved around a lot before, so wasn't really concerned, didn't have children. So I was like, I can kind of move anywhere that kind of calls to me. So we ended up in Dallas, my wife and I. And then shortly after that, I was laid off again.
Oh, my.
Yeah. So my wife kind of joked. She was like, maybe you're just not good at your job. And I was like, that can't be it. I was like, they told me it wasn't performance-based. So, but it happened twice in a row. So, I mean, that really was kind of a soul-searching moment for me because at that point, I was like, is this like the industry? Is this going to keep happening? Is this kind of a trend? So with
you were in healthcare at the time too?
Yeah, always been in healthcare. Okay. With non-clinical roles, it's been an ongoing evolution in terms of non-clinical leadership roles, in terms of hospitals trying to reduce their executive overhead. So if you have someone that's not clinical, like a COO role or VP operations role, a lot of times organizations to lean up their structure will get rid of that role and tag those duties onto a chief nurse or a chief medical officer and things like that. And then some people go through that, and then a few years later, like, hey, we actually need a COO.
More of an administrator,
so the wave keeps going. I was like, I don't know if I can keep riding this wave, but I really reflected back into why I got into healthcare, which is actually my grandfather. Grandfather's from the U.S. Virgin Islands. My mom was adopted from Germany. She grew up in the U.S. Virgin Islands. He was a general surgeon in the Virgin Islands. So around the time I was in school, he was kind of expanding his, I guess, entrepreneurship in healthcare. So he worked at the hospitals, one hospital on the island, but he also ended up, private practice. He bought a nursing home, and he ended up running into a lot of financial challenges, dealing with the administrative burden of healthcare. And at the time, I was in an accounting program, and my advisor used to be a CFO at a hospital. Okay. And he was like, you should really look into healthcare administration. So my love of business and numbers and kind of connection with, what I could do to help support and kind of be caregiver to support physicians and clinical people that went to school to take care of patients. How can I help make it sustainable and viable and things like that? So I was like, I got to stay in healthcare. I can't imagine doing anything else. So when that second layoff happened, I was really kind of just again looking, I was like, we can really go anywhere. Nebraska was by no means on the radar. I was just joking earlier today. I was like, I would have never been able to pick it up off a map. I mean, it looks like Kansas, it looks like Colorado. I was like, I would have never known. But I was very familiar with CHI Health and the recent merger with Common Spirit. And I was like, it'd be great to get in that organization. So I was like, let me give it a shot and check it out. And I just really fell in love with the mission. The mission's very unique. I've worked at hospitals all across the country. Mm-hmm. All of them have very similar missions, but a few things that stood out is faith-based, which I really like. And then also called out in our mission is advancing social justice, which is still one of the most unique things I've seen in any hospital's mission statement. I know a lot of hospitals do work to help advance social justice, but to call it out in a mission statement is very unique, and that really, really spoke to me. So I'm here 6 years later.
Yeah, that's great.
Never thought I would have been here.
Started out as vice president. And
started off as vice president and just been interim president in April. Been in the permanent role since about September.
Yeah, very cool. Hey, that's great.
Yeah,
good for you.
Absolutely.
It's not so bad out in the Midwest, is it?
It's really not.
You go from the Chesapeake Bay to the Missouri River. You know?
Exactly.
I don't think we're going to find any decent blue claw crabs out there.
Speaking of that, it was very funny. My wife hates when I tell this story, but when we moved here, she was pescatarian, so she was only eating seafood.
Okay.
When we were in Dallas, so we moved to Nebraska. I was like, I don't know how this diet's gonna work out. So all we did was go to plank and shucks for a while.
Shucks, that's what I was gonna say.
But then we finally transitioned away from that. But it was decent seafood here. But I've always been leery of traveling and finding Maryland crab cakes because they're not from Maryland.
No, they're not from Maryland. You got to get them right out of the Chesapeake.
No, absolutely.
So, not to put you on the spot or anything, because I promised I wouldn't do that, but what's going on with healthcare in America now, and especially in Nebraska? Is healthcare broken? Is it in a transition? What's going on with healthcare now?
Yeah, I mean, one of the things that I say, I know there's a lot of activity and conversation with the new administration, and that always happens when there's change of administration. There's always a lot of different things moving and going on, especially from a healthcare standpoint. But one of the reasons that I really gravitate to healthcare and staying in healthcare is I do think it's overall a broken system. And I think it's easy to blame, it's the hospital, it's the insurance companies, it's the pharmaceutical companies. But when it comes down to it, it's just the system is designed to get what it gets. So, it's broken in that sense, and just the way certain groups are incentivized to do certain things. Each organization within healthcare is doing what it's designed to do. And, we're a capitalist society, and people are making space for themselves to make money and also trying to provide healthcare. But it's very frustrating for me to see the disparity in U.S. healthcare compared to similar countries across the world. When you think of actual health outcomes, we have some of the worst health outcomes for similar countries our size. And also some of the most expensive healthcare. Oh, wow. So it doesn't make sense that we would cost the most and have some of the unhealthiest people and unhealthiest outcomes. Yeah. So that's something that it's very much a lofty goal, and no one person or one organization can fix it. But that's one of the things that makes me very passionate about healthcare, and there's always ongoing changes.
And how does it relate nationally to what we have in Omaha? We're pretty lucky in Omaha. We have I think we have a pretty good healthcare system between CHI and the Med Center and who am I missing there? Lakeside, or that's part of? Yeah,
that's all CHI. Methodist,
sorry. Yep. I don't want to leave anybody out.
Yeah, it's all good. I make sure to shout them out. I tell people all the time, I'm not obviously I'm partial because I work for CHI Common Spirit, but having been across the country, I've seen a lot of cities that don't have a good healthcare system, or there's always like one or two hospitals where people are like, I wouldn't take anybody over there. We have a lot of really good health systems. Then you think of Bryan Health in Greater Nebraska, and so there's so many different hospitals. Yeah. We have a lot of really good hospitals for sure.
Good stuff going on. Your hospital itself. Why don't you give our viewers a little background? Because you guys kind of specialize in the North Omaha area, correct?
Yep. Yeah, so a little bit about Emmanuel. Late 1800s when we were founded, so over 35 years we've been around. We're licensed for about 365 beds. Our real core services are behavioral services, which is something that's very a strong connection to me and my family. We have #1 rehab institute in the state of Nebraska, another key service, neurological institute, and also a very large primary care footprint. So we just opened a brand new primary care facility on campus in September. and actually doubled the capacity we're able to
wow.
take. So we've seen 27% growth. So that's really good to see, because at first when you build a new building, you know, it's just a new building. So it's nice to say, hey, we have this huge building and, you know, we have all these different things, but if people aren't coming to it, then you just have a big building. So we are seeing that growth and serving the community. One of the things that's unique about Immanuel from a geographic standpoint, we are the only full service hospital north of Dodge Street.
Okay.
So a lot of times, one thing I've learned very quickly when I moved here is North Omaha. A lot of people, when they say North Omaha, they mean Northeast Omaha, in a very specific part of Northeast Omaha, closer to downtown. But so when we say we serve North Omaha, it is Fort Calhoun, Bennington, the whole north part of the city. Yeah. So we have a large outreach, and it's interesting. There's a lot of diversity. It's a very dynamic patient population, with a large concentration of African Americans, refugee population, a lot of Southeast Asian populations. One of the most popular languages after English and Spanish spoken by our patients at Emmanuel is Karen.
Oh, wow.
And I was not even aware of that language before I moved here. So we have a lot of diversity from that standpoint, but then also we have a dynamic of, we have a lot of patients that are underserved, can't afford the care they need, or having financial challenges and things like that. But then we're also just down the street from the Omaha Country Club, and we serve a lot of very wealthy zip codes. So it's a tale of multiple cities for sure.
Yeah. And your hospital in particular, you employ about 1,200 employees?
Yeah,
there?
Pushing
that's
it. Yeah,
pretty sizable. Staff.
Yeah. I'm glad you bring that up, because that's really my core focus, and I like to emphasize that with people. My philosophy and why I'm passionate about leadership is spent so much of my life hearing about how people don't like their job, and it's just even being a kid and just hearing people my dad's age, older than my dad. I was like, you spend your whole life not liking what you do. I was like, we spend way too much time at work. So I've seen a lot of different studies. We spend more time at work than we spend with a lot of our family and friends. So, that should be meaningful and that should be impactful. So I take that as a personal responsibility to make sure that is so for our workforce. And I make sure that our leaders, we all take that responsibility of, we're responsible for a significant portion of people's lives.
Yeah, absolutely.
So, we're an employer first before anything else. We're responsible for a lot of people's lives from an employer standpoint, not to mention all the thousands of patients that we take care of. So it's a big responsibility.
Yeah, and I remember years ago, and it's probably the same in the hospital as it is in the hotel business. I had Bill Marriott tell me once.
I used to work in Marriott for a little bit.
Did you? You did?
Yeah. In
Nice.
college. Yep.
Where?
Back east.
I started in Washington, D.C., actually.
Yep. Very nice.
At the Washington Marriott. But
it's corporate. Yep, Bethesda.
Yeah. But he had told me once, Gil, you take care of your employees will take care of your customers.
Yep. And
customers take care of in his case, profit. Now, you're a nonprofit organization, correct?
Yeah.
So it's a little bit different from that aspect, but it's the same philosophy is you're taking care of your employees because they're taking care of your customers, which are your patients.
Exactly. Yeah. So I kind of got that same philosophy from the former Southwest CEO had a very similar philosophy of you take care of the people and they'll take care of the customers. Because when you're in a leadership role and you're not providing direct care, you're not actually doing the work, the most influence I have is over the leaders that do take care of the people. So it's something that's interesting that just came out actually from Gallup. It was one of the things I shared with our team.
Which is based in Omaha.
Exactly.
Too. That's great.
I love Gallup. I'm a big Strength Finders person, but they did a survey internationally, I believe, and they asked people the most influential positive leader in your life. And the large majority of people said family. And right after family was your manager. Your manager is the second most positive influence or potentially negative influence in your life. And I was like, we can't take that lightly. So
have you started any new initiatives, or when you took over as CEO, were there any major challenges with that aspect of, and not to disparage previous administration?
Not at all.
But.
No, it was funny. I don't know what happened, but it seemed like a switch turned. There became a lot of weather-related incidents during my time when I started. I was like, I don't know if I brought it with me or if that was part of the test, but we've had tornadoes and floods and power outages and all the windstorms and things like that. So it's been no shortage of challenges. But we sign up for that in healthcare. It's something that sometimes you kind of bellyache about, but I was like, we all self-selected to be into this. So, I mean, we like it in some weird way.
And so you started here just before COVID.
Yeah.
Where were you at in terms of healthcare relating to the COVID outbreak from 2020?
It was interesting because my role was kind of brand new. So I started my role. I was just really trying to learn, what are the opportunities? My role wasn't there before. So I was like, what do I need to jump into? What's already covered? How do I fit into the system? And then COVID happened, and then right. And then COVID happened, and nobody knew a job description.
Yeah,
it was just a lot of unknown, and unlike a lot of people that were quarantined at home or working remote, even as leaders, even though we didn't provide direct care, I was in the hospital every day.
Yeah,
every day, masking up, rounding with people. I mean, we needed to live what we were talking about. I mean, if we're going to be there to support people, we got to be there to support our staff and they're supporting patients. So it was an interesting time, man. It was an interesting time.
And you probably rewrite a lot of job descriptions or, I guess, emergency preparedness plans.
Yeah.
In the event something like that could happen again.
Yeah, there's a lot more focus on emergency preparedness for sure. It was always something that there was training for, but you didn't enact it as much. But COVID was something we really weren't prepared for because most of the emergency preparedness stuff is for it's for very short term emergencies. It's not for something that lasts 6 months, 8 months, 9 months, 2 years.
Yeah.
It's usually for crisis and different things like that. But so there was a lot of learnings from it. In healthcare overall, I mean, obviously a lot of lives lost. So don't want to diminish any of that. There's a lot of challenges, but there's a lot of discoveries that came out of it, whether it's clinical discoveries and about viruses and genomes and stuff, or just processes we learned at the hospital that we had to figure out how to do or do without, and then realizing like we can just do this way all the time. This actually works better.
Yeah.
So it kind of forced us to innovate some better practices.
Interesting. Sure. So the hospital itself, was it recently or is it currently going through several $100 million renovation, or what's?
Yeah, not quite. I wish we had several $100 million or
$100 million.
Yeah, there's a few different. So one of the big projects was the Family Health Center. That was a pretty significant investment. Another one we're working on. So in order to that primary care practice that went into that building, they used to be in another building on our campus.
Okay.
So in that space that they vacated, we're working on $7 million project to renovate that space to add more specialty care. Okay. So if we're adding more primary care and we have, we're getting more referrals potentially, we want to make sure to add the specialty care so we can keep that on campus. So things like GI and urology are things we're working on expanding on the campus.
And you didn't have that specialty care before?
We did, just expanding more of it to match the expansion of primary care. So those are some of the bigger focuses from a building standpoint.
I would think, I think I was reading an article that you were part of talking a little bit about social screening. Is that correct?
Yeah.
Could you talk to our viewers a little bit about that aspect of healthcare and what the hospital is doing in that area?
Yeah, absolutely. So I think it was last April, the government mandated that all hospitals actually need to start screening for social needs.
Okay.
So every patient gets, when they're admitted, they get questions asked about, do they have challenges with accessing healthy food, paying bills, transportation, all those kinds of things. Because as I mentioned to you previously, one of the stats that I repeat a lot is from the World Health Organization.
Right.
And they really say an individual's overall health is much bigger than their health care. So your health care itself only represents about 20% of your overall health. So your prescriptions or surgeries or procedures and things you're getting from your doctor only represent about 20% of your overall health. Everything else is just your environment, the crime in your environment, your ability to have a safe place to live consistently, and having access to food and being able to get transportation. All those things have a much bigger impact. So we're starting to lean into that a lot more, not just as a hospital, but as an entire health system to better understand what are those barriers. So we're kind of in that phase of this first year really getting the best idea of what are the key themes we're seeing with our patients. Is it more food insecurity? Is it more transportation? So as we gather that information, as other hospitals are, we can start to look at what are the best interventions that we need to put in place to help support patients outside of the direct healthcare that we're providing.
Do you see more of that need in the North Omaha community than other areas of the city?
Yeah, there's definitely a disparity, but it's unique because a lot of times you think of like income status. I mean, that's obviously a very strong indicator, but even in West Omaha, there's certain populations, especially elderly, that don't have access to transportation. So getting to appointments, and there's disparities in all kinds of different ways.
Sure.
So it's not always race-based or income-based. There's a lot of different things that go into health disparities that we're looking at addressing. So it's every part of the city, and any city has different areas of opportunity, which is why we're all kind of individually looking at what our patients are saying about us so we can create something unique. So something that we opened up in last May, which is before we really got any of the screening like kicked off to really see any themes, we had built a new chapel a couple years ago in our hospital's gorgeous chapel, beautiful stained glass. But the space that was vacated as a former chapel, we were wondering what to do with it. And a few of our staff came together and it's like, we should put together like a community closet. We call it a community corner. But one of the things we noticed is a lot of times people come to or leave the hospital with, they don't have proper jackets, shoes,
or something.
People that have newborn babies don't even have all the things they might need. So we collected donations from all across the hospital.
Oh, wow.
And we opened this store. It's beautiful. I mean, we have clothes, we have non-perishables. I mean, there's toiletries, there's babies, there's shoes, there's all kinds of stuff. So that's been a very helpful way to connect and support our community beyond healthcare. So continue to kind of build on those things more strategically.
So in that in that community room, is that something that people in Omaha can donate to, or is it just through the hospital? Or?
So at first we had so much of an outpouring of our own staff. Like we have way more stuff than we know what to do with. So we filled the room. We have like multiple storage facilities across the hospital that we're trying to put all this stuff in. So we actually have more than enough. But
so don't bring anything down tomorrow.
Absolutely. When we do start to run out, we'll make sure to make a push for sure. But yeah, we've been lucky to have our staff really supplying the large majority of it. So like as people get screened on the floor from part of that screening process, we're making sure our staff are aware of like let's do a referral downstairs, and we can take them downstairs. It's not like an open store where you can just walk into. It's locked and you have to be accompanied by a staff member. But if you are screen positive, the staff members can go in there and you can grab whatever you want.
Grab whatever they need. Talking about staffing a little bit, the unemployment rate, and I've had this conversation with the State Economic Development Director, with Heath Mello, the Chamber President, not necessarily in the healthcare field.
Right.
What's the effect of a very low unemployment rate here? Are we short-handed with medical personnel, and what's CHI doing locally or nationally to attract people to come to Omaha?
Yeah, that's a loaded question. I mean, I think, one of the things that we've been focused on is, again, being a best place to work, making sure that we're not just recruiting people, but we're retaining people. So the past couple of years, we've been very, very focused on our retention. So looking at how we're growing our workforce, and we've grown by almost 200 people over the past couple of years of, not just recruiting, but retaining. So that's a top priority of making sure we're doing the right things. We're communicating, people feel connected with the mission, they feel heard, so that they're staying within the organization. There's a lot of different programs in terms of pipelines and offering free education for people to pursue higher levels, whether you want to be a nurse from a CNA, or you want to be a CNA, or you want to get your nurse practitioner license. You're just having a lot of different wraparound
Do you help
offerings.
them in that education process?
Yep, we have a lot of educational offerings for workforce development that we're actually leaning into a lot. But yeah, really being the best place to work is one of the greatest strategies. But overall, as a healthcare industry, there is a challenging outlook from a lot of physicians, I know for sure, that are soon to be retiring, and not enough physicians matriculated through medical school that are coming in. So unfortunately, it's probably going to get more challenging going forward. I don't think we've seen the brunt of it for sure. But we're making sure we're staffed the best we can. And again, being the best place to work, we got to make sure we're keeping people safe. So safety is top priority. We're not going to compromise any of that. So
very cool. Yeah, that's I keep bringing this up. It's probably the fifth time I brought it up, but Forbes had mentioned that Omaha was the number one city to move to.
Yeah, I remember seeing that.
And you'd think that you'd be going over the Mormon Bridge or the Bob Carey Bridge, and there'd be hordes of people coming over. We got to move here, but obviously there's opportunity here in the healthcare field, and so if you're watching this show and you're not from Omaha, they can contact CHI.
Man, I can vouch for it. Coming from the East Coast, I really didn't know what to think. I didn't really have any kind of preconceived notions of what Omaha was going to be. I was just like, I have no clue what this is, what's going to happen. But immediately found out people are extremely nice, way nicer than the East Coast, I have to say. My wife says,
I'm not offended. I grew up there.
Yeah, I was like, I'm from it as well. So
I think what it is on the East Coast, and I tell people this, they think New Yorkers in particular are just rude.
I would agree.
I said, they're not rude. They just,
there's no fluff. You just get to the point, man.
Well, they don't have a lot of time to stop and talk. You got to get from point A to point B, and it's fast, and you're trying to catch a subway. You're trying to catch, man. Here we have 20 minutes, 30 minutes. We could be from downtown Omaha to Valley.
Yep.
And, you have time to stop and talk to people.
It's a different pace of life for sure.
Absolutely.
But it's a nice balance of like, it's not a large city, so it's not hard to get around. It's easy to know people.
Right.
But it also still has, great restaurants. There's growing amount of things to do. We moved to downtown when we first moved here, and then COVID happened. So it was dead silent most of the time.
Yeah.
And Capital District started evolving, and the waterfront and everything with the Luminarium and the Gene Leahy Mall and all those kinds of things. We've invited more and more family to come out. Our first daughter was born last March, so she'll be a year next month. But as we've had family come out to visit and check it out, it's been interesting to see that perspective of like what they thought was going to happen. And it's like, I thought it was going to be tumbleweeds and cornfields. And I was like, cornfields are close by, but there's a lot more to it than that. So.
A lot more to Omaha. So in the last couple of minutes or so, is there anything that I left out or anything you want to talk about in particular that we didn't discuss that we can...
One of the things that more recently that I've got involved in, I joined the March of Dimes. We've got the fundraiser coming up, but one of the big opportunities we have in healthcare, and it's been more of a personal connection to me now that I've, not I, but we've had my daughter, is just maternal health. So being on the March of Dimes, they do across the nation, they do a scorecard for every state in terms of maternal health outcomes, and they give you kind of a report card. And the state of Nebraska is at a D for David. So there's a lot of opportunities. And this is one of those areas where there is disparity where African-American women are 3 times more likely to experience some of these complications than white women. So there's a lot of disparities and things we're working to address. Again, it's not just...
based on preventive health care?
It's a combination of things. A lot of it is different prenatal access and things like that. Some of it's education and awareness and access to health care and different things. So there's a lot of focus. We're working on that. We're expanding our ability to care for more complex newborn situations at our hospital without having to transfer them out. So we've added some additional specialists at Emmanuel that'll be starting actually this weekend to be able to expand that care. So that's something I'm really passionate about, working with different organizations to leverage doulas as kind of a partner to help support people through pregnancy, not just the clinical piece of it, but just everything that goes along with it during pregnancy and also postpartum. So a lot of focus on making sure we can get those numbers right and making sure our babies are safe and
want
healthy.
To keep them all healthy.
Yeah, absolutely.
Grow up here and then stay here. We don't want them leaving.
Absolutely. Yep.
So, well, great, Anthony. Thank you so much for joining us today on the podcast. It's very interesting to hear about different initiatives at CHI that your hospital in particular is working on, and the healthcare industry in general, locally and nationwide. And people want more information on CHI website.
Yeah, we got all kinds of websites. CHI, LinkedIn, our website, Common Spirit, our parent company. Me personally on LinkedIn, I'm pretty active, so I'm easy to find and easy to approach and access. So, I appreciate the invite. It was a good conversation.
Yes, that's great. Thank you so much, Anthony. I really appreciate it. All right.
Likewise.
Thanks again for joining us today. Hit that like and subscribe button so you'll never miss an episode.